Assalamu alaikum. Minasam konnichiwa. Good day, everyone. Today, I'm going to talk about polio and vaccine-preventable diseases and public health challenges in Gaza Strip. I am Abdul Rauf al-Maname, PhD in microbiology from the Islamic University of Gaza. Before we start, I have to thank the organizers, the Japan Committee for UNICEF, the Center for Decision Making of Waseda University, also a liaison for organizing this important event. And I would like also to thank you for this opportunity to speak about a critical public health issue. This presentation is mainly based on WHO, UNICEF, and peer-reviewed evidence, as well as lived public health realities on the ground. The goal of this presentation is not only to describe what has happened, but also to explain why these events really matter, what they signal about wider spectrum collapse, and what can realistically be done in the short and medium term. The content of this presentation is to summarize the recent polio event and response in Gaza, describe how the conflict has impacted routine immunization and the risk of vaccine-preventable diseases. Also, we are going to outline other urgent public health threats such as malnutrition, water, sanitation and hygiene, or what is commonly known as WASH, disrupted services, and antimicrobial resistance, which is AMR in short. Also, at the end of this presentation, we are going to offer recommendations for public health actions in the short and medium term. This is the map of Gaza Strip. Gaza Strip is divided into 5 governorates, and it is densely populated with over 2.2 million people. This is before the war. During the war, we have the northern Gaza was totally destroyed and it is inaccessible to Gazans. Also Rafah and parts of Khan Yunis already occupied by the Israeli forces. And this strip also is off limit to the Palestinians. And the remaining part is now holding the 2.2 million, making Gaza right now is the most densely populated area in the world. Of course, this war has also resulted in the fragile health system has collapsed, displacement to overcrowded, sheltered and damaged infrastructures. All the people from the North Gaza, from the middle area, from the Rafah, they were all transferred into this small piece of land that is remaining for the Palestinians, making them very crowded. These are the latest number from Al Jazeera website. Over 70,000 deaths, 171,000 injuries. Since the ceasefire, almost 400 people were killed and more than 1,000 were injured. These numbers include 463 people who died due to starvation or malnutrition. The conflict affected all aspects of life, including immunization and disease control, health facility damage, staff loss. We have lost almost 1,200 healthcare workers. Supply chain of all supplies has been disrupted or collapsed. Interrupted cold chain, we have no electricity at all. We don't have transportation. Roads were also destroyed. So routine doses for immunization were missed, and suspended outreach to areas far away from the center of the Gaza city. Surveillance gaps due to limited testing, because all the laboratories also were either destroyed or partially destroyed. Wastewater was giving us some information at least about the polio, which was monitored for polio viruses. What really happened during the Gaza polio outbreak is that a circulating vaccine-derived poliovirus type 2, which is in short CVDPV2, sequences detected in wastewater during routine WHO sampling and testing outside the Gaza Strip. And at least one case was reported during 2024. This event constituted as an outbreak risk because of low population immunity from disrupted routine vaccination. We all know that to protect the community from polio, you need very high vaccination percentage, more than 95, but the level was lowered to below 90. Before the war, it was almost 199.9% immunization coverage. The emergency response was in the form of awareness campaign and also an emergency vaccination campaign with the novel oral polio vaccine type 2, or in short NOPV2 campaign, which was conducted by the Ministry of Health with the help of WHO and UNICEF, which targeted in their campaign all children below 10 years of age. And this was during February 22 to 26, 2025. Campaign reportedly reached almost 600,000 children in the 5-day campaign. There were a lot of challenges, especially operational challenges during the vaccination. We needed a ceasefire or a temporary ceasefire or pauses at least for safe movement and outreach, cold chain equipment, safe sites, security for health teams often lacking, vaccine hesitancy because people are concerned more with the food and shelter. They hesitated to vaccinate their children during that campaign. So awareness campaign was also launched to enhance their potential to vaccinate their children. Other vaccine-preventable diseases risk, such as measles, pneumococcus, rotavirus, and diphtheria. I will just have an introduction in this case. During the 2 years, as a microbiologist, I have witnessed an outbreaks of diarrhea, water diarrhea, bloody diarrhea, hepatitis A, several outbreaks of skin diseases, lice, even scabies, respiratory diseases. So all sorts of diseases were spread during the 2 years, and in an unprecedented numbers. We haven't seen this before in Gaza Strip. So we usually, during the conditions created by war, we suspect that we can have measles due to also low coverage of routine vaccination. Global measles resurgence underscores risk also. Pneumonia pathogens such as pneumococcus and Haemophilus influenza type B and rotavirus causes morbidity, especially in malnourished children. Pneumococcal conjugated vaccine pentavalent rota gaps increase risk of outbreak. The conditions are there and the preventive measures are not there, including the routine vaccination or vaccines. Malnutrition amplify or intensify the problem of infectious diseases risk. When you have malnutrition, then you have a poor immunity, then you have more susceptibility to infectious diseases. Infectious diseases also decreases the ability of the body to make use of the nutrients, and thus the cycle or the killing cycle of infections and malnutrition can continue even after the killing of airplanes and tanks has stopped. So I think we have a problem of malnutrition that was recognized by all international organizations, and some have declared famine in some areas for several periods of time, and unfortunately this was some sort of organized famine. With regard to the conditions of WASH, which is again water, sanitation and hygiene, crisis and environmental surveillance, as you have seen, you are seeing the pictures. Drinking water, safe drinking water is not available. In one small study, 85% of drinking water samples collected in one area in Gaza City contains no chlorine, thus making water susceptible to infection. Even if the water is safe, the container that is collected in used to house the or store the water is not clean. Also, the accumulation of sewage and in the streets, seeping to tents, seeping to everywhere, this also increase the risk of spreading infectious diseases. The health system capacity and attack on care. I think the pictures also appearing in this slide tells the story that almost all hospitals have been attacked in one way or another. Some with a varying degrees, of course. Some were totally eliminated, others some buildings were burned. So the functionality of those hospitals are reduced to maybe 10%, 20%, 30%, depending on the damage that has been sustained to these hospitals and to the area where the hospital is located, because sometimes maybe the hospital is not totally damaged, but the accessibility to that facility is so difficult. Thus, destruction of the physical places of hospitals, in addition to shortage of the personal protective equipment, PPE, sterilization techniques due to electricity shortage, or to disinfectant shortage also are there. Oxygen hamper routine, all these shortages hamper routine and emergency care. Antimicrobial resistance has complicated also the vaccine-preventable diseases with the emerging of multiple drug resistant or pan drug resistant sometimes in our hospitals. And there was a short commentary published in the Lancet, me and my colleagues. We have demonstrated very high level of antimicrobial resistance during war at Al Ahli Hospital, which is a similar environment to all other hospitals in the Gaza Strip. We have also one of the challenges, that is surveillance. We were able to produce some data from one hospital, but it was not possible to produce this kind of data in other hospitals or from all other hospitals due to either destruction of the laboratory, so there is no data, or because of the lack of electricity or electronic records, so it was so difficult to obtain such data from such hospitals. We can now talk about the short-term public health actions, priority actions I mean. Sustain and scale mass vaccination. We will have to continue the catch-up vaccination, such as polio, MMR, and pentavalent vaccine, PCV, and rotavirus. Also, we need a real humanitarian pauses. When I say a real humanitarian pauses, I really mean that the ceasefire that is now on place is not fully respected, and still we have almost 400 or 500 people were killed during that ceasefire. We need also WASH, emergency repair, and hygiene promotion, because this has totally collapsed due to the unsafe water and the lack of hygiene material and chlorination of water. Nutrition screening and therapeutic feeding for acute malnutrition, as I said, despite the improvement in food in Gaza after the ceasefire, still we don't have full access to all types of nutrients. There are limited food that are entering in the Gaza Strip. With the priority term action, I'm sorry, the electricity has also gone off. We have to rebuild cold chain and supply lines. We have to restore routine immunization services. We have to strengthen the surveillance, wastewater labs, and health workforce support. Also, we have to integrate immunization with nutrition and WASH program for holistic impact. We can't really focus on one point without tackling other points or ignoring other points. So we have to integrate immunization, nutrition, WASH as a holistic approach. We also have to look to how properly engage community and to communicate risks of infectious diseases. We have to encourage many of the community leaders, NGOs, and social mobilizers to reach displaced families and reduce hesitancy. This is usually done by the UNICEF in Gaza. However, we have to increase the dose of community engagement and risk communication because of the development of new diseases or the spread of new diseases once in a while. Coordination and partnerships, multilateral coordination such as the WHO, UNICEF, Ministry of Health, NGOs, donors is essential for access, supplies, and security agreement. And it must be so easy in such condition to coordinate with international organizations to support the disaster areas like Gaza. Unfortunately, coordination in Gaza is very difficult, and maybe all of the international organization can clearly say that it is really difficult to coordinate in Gaza because of the Israeli rules and regulation that is put to hinder or to postpone some of the shipments that are required by these international organizations. Ethical and protection considerations. Of course, we have to ensure child protection, avoid coercion, protect health workers, and provide safe haven and environment for these workers, and to adhere to international humanitarian law when negotiating access to services. Metrics for monitoring success. We have to also put some metrics like the coverage percentage by antigen, number of vaccinated in campaigns, acute flaccid paralysis surveillance, sensitivity, malnutrition admission, water quality indicators, which is really very important to evaluate the success of our actions. So without metrics, it is really difficult to say that we have done some work, but this work is successful or not successful. The case study that was presented earlier in Gaza during the polio vaccine shows that polio efforts or polio eradication efforts can be destroyed by war and by famine and by disaster. So there should be plans, emergency plans for all countries to keep these efforts that have reduced the number of polio cases to zero. We don't have in Gaza for 25 years, we did not have any case of polio. But after the war, we have one case of polio, and the risk of spread of the disease is still there. In summary, we can pinpoint 5 most load-bearing statements in this talk: that we have detected the polio virus in Gaza wastewater and outbreak risk is still there. We have responded by emergency vaccination with novel oral polio vaccine type 2 campaign, which has covered almost 600,000 children. We need for real humanitarian pause. When I said real, we really mean real ceasefire or real humanitarian pause to carry out vaccination. We have to consider highly the risk of rising acute malnutrition, which really make the population susceptible to various vaccine-preventable diseases. Health system degradation and attacks on care was very common during this period. To conclude, Gaza faces real and immediate vaccine-preventable disease risk. Polio detection in sewage signaled transmission risk. Emergency campaign can work but requires access, cold chain surveillance, wash and nutrition support, and this requires coordination with various international organizations. Multi-sector right-based approaches, health plus wash plus nutrition plus protection, are essential. Finally, I also would like again to thank you for organizing such an event, and this is a call for the Japanese government and people to continue the support of the efforts of polio eradication, as well as other vaccine preventable diseases all over the world, and most especially during this time in Gaza. And thank you very much. This is a list of the references that I have used in this presentation. I would like to again thank you for this opportunity.